Hi, I'm Hayley, isolating with COVID at the moment.
It was a good New Year's for Hayley Hughes. But now she's paying for it, joining the tens of thousands of Victorians who have COVID. Like many others, after recording a positive rapid test, she chose to skip the long testing queues and not get a PCR test.
It just doesn't seem worthwhile to put other people at risk when I know that I'm positive.
Now the government will officially count these cases in its daily tally.
It's clearly time to recognise that a positive rapid antigen test has the same authority as a PCR test.
From tomorrow, it will be mandatory to report all positive rapid tests online or over the phone to the Department of Health. Those who record a positive result will need to isolate for 7 days and inform their close contacts, but they'll also be linked to health resources and be eligible for income support.
So I'm definitely going to check that phone number when it launches because I do want my rapid antigen to be counted as a positive just in case I do get sicker.
And there are a lot more positive cases out there than are being officially reported. Today, the government said that it believes 1 in 50 Victorians has COVID and that 1 in 20 people in their 20s has the virus. The spread has prompted more density limits for indoor hospitality venues, 2 weeks after the Chief Health Officer advised the government to do so.
We are confident that in coming days, these measures will play a part in taking off some of that increase in growth.
We think 1 in 2 square metres, although disappointing, is probably a commensurate response.
For smaller operators, though, it's increasingly difficult to make the numbers work. This restaurant just opened in November and will have to cut capacity from 140 diners to 70.
It's not able to break even, I'm going to say, to be honest.
With no sign it's going to get better anytime soon. Jessica Longbottom, ABC News, Melbourne.
From Bendigo to Ballarat, testing lines are reaching capacity before they open.
It is putting extreme pressure on health facilities and hospitals.
And in Gippsland, the flow-on from Melbourne's testing pains are being felt in the regions.
We've had people who have arrived in our line because they have travelled from the other side of the city and gone to testing centres at every point and ended up here at Wonthaggi because they thought they might get in.
Creating extra pressure for regional health workers.
We're more stretched than we've ever been. It's certainly the most dire we've been in terms of our staffing shortfalls.
In Swan Hill, the town's testing centre is only able to open for 2 hours each morning. Locals like the Phelan family, who caught COVID over Christmas and stopped their holiday in Geelong to get a test, say getting support and answers was difficult. They waited 7 days for their results. Their first call from a health authority asking if they were okay came on day 7.
The challenging thing was that the rules just kept changing all the time, which made it really hard because we sort of didn't know exactly what was expected of us.
And because the hotlines were closed too.
Regional health workers are bracing for a tough few weeks ahead as smaller country hospitals don't have equipment like ventilators.
The modelling says it's going to get worse before it gets better. But it will get better. I'm hopeful.
The recent change in testing requirements is at least releasing some of the pressure in Ballarat.
The demand is starting to ease for us with the announcement of rapid tests being used instead of having a PCR.
Some relief, but regional testing centres still facing a torrid few weeks ahead. Shannon Schubert, ABC News, Bendigo.